Welcome to a new episode of Conpide podcast. As you see, we have once again changed the setting. We are at the Planas Clinic in Barcelona. Because for anyone who doesn't know the Planas Clinic, it's Dr. José Planas' clinic, who, as you know, has been on the channel and is a dear friend of mine. And it's the largest clinic for cosmetic surgery in Europe. They've let us record here today, which is awesome. I assume they'll be filming. Dr. Jorge Planas has given us permission to record today's interview here. As you know, I'm from Madrid, so I came to Barcelona just to meet today's guest and to have the opportunity, of course, the pleasure of interviewing him. So, without more delay, I will introduce the guest. Our guest today is a surgeon at the Hospital of Barcelona and president of the senior section of the Medical College of Barcelona, as well as the Association of Senior Physicians at the Bellvitge University Hospital. Plus, he has authored 92 medical articles. He has written a book on pancreatic cancer and received the Professional Excellence Award from the official Medical College of Barcelona. It's great to have Dr. Manuel Sans Segarra here today on a new episode of Conpide podcast. How are you?
Good morning. It's a pleasure and an honor to be with you all, and with the aim of clarifying important aspects that I believe can help to open minds, to awaken consciousness, which I think, and I am eager, that this is one of my goals, of all my efforts.
Well, today is a first, Doctor. I've mentioned this before, but I'll say it in front of the audience. It's a pleasure to have you here. I found you a year ago, and I've watched a ton of your interviews and conferences because I find them very interesting. Today we will talk about topics that, as you have said, will open minds, and I believe will be very important. And I think many people who will be listening to us will even change their lives and their way of thinking. Before that, I wanted to bring up a book of yours that will come out this fall, which you are co-authoring with Juan Carlos Cebrián, if that's okay with you. The reason I bring this up at the start is that many people, after the interview is over, really enjoy the interview or have truly appreciated the words of They always ask me how we can, has he written a book? Can we find it, etc.? So, if you don't mind, I ask this to clarify for the viewers.
Yes, I became interested in these topics, especially near-death experiences, because of the stories and experiences shared by patients I treated with a clinical death diagnosis, and I, reviving them with cardiopulmonary resuscitation methods, managed to recover some of them. Some of these patients mentioned near-death experiences. I have researched this subject thoroughly. I have connected with other experts to enhance my knowledge. And in the end, my experience, I have tried, and also due to many requests from people asking me, I have written a book that collects all these experiences and stories from my patients and my conclusions in studying them, where my good friend and journalist Juan Carlos Cebrián has helped. And that it is already in the printing process at Editorial Planeta, who will be the one to, I estimate that by summer the book will be available. In other words, it will be ready for purchase. The book's title is La Supraconsciencia Existe. 2 points. Is there life after life? No. Book title.
Fantastic. Well, the viewers now know, so stay tuned. This will be published in March. Well, you will have to wait a few months, but it will be worth it. So today, Doctor, we will go over what you brought from here to us in Barcelona, which is life after death. But first, I'd like to ask you if we should fear death.
Our current society, our civilization, is largely based on great materialism. And the identity of this materialistic society is what we define as the ego. The ego is our identity. I repeat, it is materialistic, has an external origin. Therefore, it is insecure, incomplete, changeable, heavily dependent on others' opinions, and its goals are success, fame, wealth, power, control. In order to reach these objectives, the ego frequently takes on negative life patterns characterized by excessive competitiveness, jealousy, envy, hatred, aggression, and violence can take over. I like to recall Gandhi's words when discussing violence, who said, "Violence is the limit of incompetence." Okay? Since the ego is wholly based on the material, on the body, and we all know that death is real, it is the most democratic reality, no one can escape it. When a person passes away, the body disappears and transforms, and then the ego disappears. This explains why in today's society, as the ego reigns and the ego realizes that death represents the end of its existence, people fear death. Death is a taboo. Why do we fear death? People fear death mainly because the passage from life to death can often be hard, painful, and full of deep loneliness. We have all known a family member or friend with esophageal or pancreatic cancer, which is what I operate on and manage, as the patient declines suffering until it culminates in cachexia, just skin and bones, to the point where, upon passing, family and friends say, "Now the poor thing can finally rest." In short, the transition is intimidating. Secondly, because it implies a transition to the unknown, which is what most troubles the ego. We don't know what occurs. People are clueless, and there is much ignorance surrounding it. The third reason for fearing death is that we leave it all behind. We leave behind family, friends, material possessions, for which we have fought so hard, even wasting our lives. We come with nothing and leave with nothing. Lastly, we have a very strong instinct for self-preservation that ties us to life. These four factors influence our perception of death in this society where the great ego and egomania dominate. As a taboo, as something frightening, as something we fear. That's why people don't want to talk about it. It's a topic that people prefer to set aside.
To explain death, that is, to someone who has just lost a family member, what should we tell them? How should we explain this?
To understand death, it is crucial. It completely relies on our existential perspective. If we center on the ego, no matter how we clarify, the only thing we can tell a person, a friend, or a family member is that the person who has died can now rest. Because with death, all things end. In other terms, we will never see them again, and we will know nothing about this person. However, this is not our existential reality. Our existential reality, and today we have genuine, objective evidence with a scientific foundation that allows us to demonstrate that our existential reality continues after death. This is called non-local consciousness, supraconsciousness, or spirit. It can be defined in different ways. If our true identity, which makes us one of a kind, persists, it means the body is just a facade, a garment we wear that we take on very temporarily. However, our authentic identity remains. So, if we embrace this existential understanding, it becomes quite easy to speak and assist family and friends when they lose someone dear. Don't worry, they have completed their journey in the human dimension, but their true essence lasts in another dimension.
Yes, I want to explore a bit more about what I said regarding supraconsciousness and elaborate further. What is this supraconsciousness and how can we reach it? Any way to access?
Yes, with the materialist idea or conception of the Cartesian Newtonian method, which adopts or recognizes a materialistic consciousness that we have defined as ego. Our ego identity is a totally passing identity. In essence, the anthropological view of humans, from a materialistic standpoint, following the scientific method, and thus with the ego identity, can be characterized as body, which is matter, and mind, with all mental and emotional functions, such as thoughts, memory, consciousness. In essence, all emotional activities are dependent on our mind. Yet from the scientific method's perspective, these activities are an epiphenomenon of matter. In other words, they are a consequence of the metabolic and biochemical activity of matter, of nerve cells. Consequently, from the view of materialism, of the ego, of the scientific method, as Descartes, one of the pioneers of the scientific method, aptly defined, I think, so I exist. What does it mean? According to the scientific method, death means to stop thinking due to the destruction of our cells, so it means to cease existing. With the scientific method, I reiterate, death means the end of our existence. Everything is over. But we know today that this is false. And how do we know this? Well, I personally, through a range of phenomena that we define as transcendent, meaning there exists, a factor that the materialistic view of the scientific method cannot explain. And of all these phenomena, the one that intrigues me is near-death experiences. What are these near-death experiences? Near-death experiences consist of a series of events and experiences reported by patients we have diagnosed with clinical death due to various causes. That is, patients experiencing cardiac arrest, respiratory failure, with no reflexes and no mental activity, having no activity at all. The electrocardiogram is flat, and the electroencephalogram is flat after about 15 to 20 seconds. There is no activity. Well, if we succeed in reviving him with CPR measures, which you know, chest compressions, intracardiac function with adrenaline to stimulate heart contractility, applying shocks with the AED, with the defibrillator, there's a percentage of patients we can bring back that I have brought back. Many of these patients have shared with me a series of experiences that truly caught my attention, always. And I want to highlight this, coinciding with the time. From a timing perspective, when the patient was clinically dead, meaning there was no cardiac activity or mental activity, that is, during this interval is when he developed these experiences. So I studied these experiences and was truly surprised by what I found. And from this, I could deduce that we are indeed physical beings, which is matter. We are minds with emotional activities, but we hold our true identity, what makes us unique and exclusive. This is what I refer to as supra-consciousness. It's a consciousness that transcends local or neuronal awareness, the one we've discussed earlier. And this consciousness lasts. It can also be referred to as non-local consciousness, because it continues beyond the brain, and others define it as spirit. We can call it whatever we like. The crucial thing is that after physical death, a consciousness persists that is our true identity and has characteristics, including being eternal. That is, it has existed, exists, and will always be. So, there's no need to fear death, because our existential reality persists and will last forever. What remains, what we lose, is the outer covering, the suit, the shell, which for a time takes on our true identity, the supra-consciousness, to create what we call human existence, which is three-dimensional, the duration of our human life. But our true identity endures, our supra-consciousness.
And exploring further into near-death experiences, which I find quite fascinating. In fact, I have several questions regarding them, and I will ask them. I wanted to ask you regarding the patients. What are they like? How do patients describe their near-death experiences? These experiences, to put it another way?
Yes, first off, these experiences are crucial. I have looked into them extensively, and I have discovered that they exhibit certain traits. They are quite prevalent. There are countless cases noted in global literature of patients who experienced near-death situations. Secondly, they show a logical organization. In third place, these experiences include a number of items or phenomena in every patient. In other words, the differences between one patient's near-death experience and another's are more nuanced than conceptual. Thirdly, patients remember these experiences for their entire lives. The longer time passes, the more present they are in their lives. Finally, they have a significant emotional impact on the patient, especially regarding their existential conception, which alters profoundly, and this results in a change in their life dynamics, in their life role. I have monitored these patients for a while to look at the serious pathology they had, how it evolves, and because I am very interested in this psychological impact. Then, if you'd like, we can talk about what the psychological impact is and how it shows in these patients. What do these patients report? These patients are afraid to mention their experience related to what we refer to as NDE, near-death experiences. Why do they fear? Because they perceive this as something unusual, outside of the norm, and they are afraid, being told that this is either hallucinations or that they are psychologically unwell. In global literature, there are patients diagnosed as psychopaths for mentioning their near-death experience and have undergone psychiatric treatment. Therefore, they are hesitant. You need to ask them and press the issue. And they report this. First, they describe the feeling of leaving their body, and from a high position, they see exactly what is happening around them. They have a big surprise because the first thing they see is their body, which a group of paramedics is identifying while they are performing CPR. They don't understand what is happening. Then they make an effort to interact. It's impossible to communicate in their situation. Through standard communication in our human realm with the healthcare workers who are trying to resuscitate their body. For instance, one patient came and attempted to touch me, and she was very surprised because when she did, she went right through me. They easily pass through solid structures. This patient, for instance, went through and recounted all sorts of details about what was going on in areas that can be quite distant, even in the antipodes. There are recorded cases of patients being resuscitated in the US who described what was happening in the antipodes in Australia. One of my patients referred to me while her body was clinically dead, and while they were performing resuscitation, she informed me about everything occurring in my ER, which has several sections. Following that, they report contacting some entities, which they refer to as beings of light, that aid them. They increasingly notice a sensation of peace, harmony, and joy. It is often the case that people reach out to deceased loved ones. A patient of mine contacted her mother, which brought her a lot of joy. And finally, all mention a light. And by connecting with the light, they experience peace, harmony, and particularly joy and love, attains heights never felt in the human realm. It is also common for them to report that, as if on a screen, they can observe the most important events in their lives. And at last, these beings of light inform them they need to return, as they haven't finished their cycle in the human dimension. The majority say they don't want to go back. Because the situation is so pleasurable and joyful in the other dimension they are currently in that they do not want to, others request to return out of responsibility. For instance, mothers with small children who have responsibilities wish to return willingly. However, the great majority decline. Overall, this, with small details, it logically influences the person's cultural or conceptual level, their religious background and principles. They introduce, as you can guess, and I don't want to cover aspects related to religion, but logically believing people introduce terminology linked to their religious beliefs. But conceptually, what matters are they? All these items are very well described by Bruce Grayson, one of the foremost experts globally on near-death experiences.
Then I also understand that one characteristic of near-death experiences is that they are extremely vivid experiences, far removed from, say, hallucinations. There is even a very famous doctor, Eben Alexander, who was initially very resistant to this type, practically materialistic and very dismissive of spiritual matters. He had a near-death experience, and since then he has become a firm advocate for them. He says that these are very vivid experiences which are not at all foggy, misty, or blurry, so I wanted to ask him as well. Normally, the sick, or rather, the people who have had near-death experiences undergo a transformation, which is very unlike what happens with hallucinations, for example. Normally, for example, they lose their fear of death, the loss of loved ones becomes relative, they start to have more peaceful lives, they think about deeper issues, well, more along the lines of love, friendship, family, and other similar things. Is it true?
Absolutely true what he said. First of all, they refer to it. The near-death experience, they define it. They say, "Doctor, this is not a dream. It is entirely distinct from a dream. It is a brutal emotional impact that these patients experience." They have. Therefore, as I mentioned earlier, I have been following these patients and have attempted to uncover and check what the psychological effect is. For them, it holds great depth. To begin with, they express that they feel this way, as I referred to at first. Very misunderstood. They cannot share their experiences with doctors, nurses, family, or friends because they do not understand them. As you have rightly said, they are told that these are hallucinations or strange experiences that should not be given importance. Secondly, they lose all fear of death. I have had patients tell me, "So true. They told me this. They say, 'Doctor, you harmed me by reviving me. You completely harmed me. I didn't want to come back and you revived me.' Other patients have said, 'The near-death experience has provided me insight into my real existential reality. Now I really understand what life is. I know what life is in the three-dimensional human situation, and I know what my existential reality is, which is another dimension that sustains my life.' So I inquire, 'For you, what is birth?' They say, 'Being born is the simplest thing ever. It's like wearing a suit, a body, which is like a suit, a shell, a container that we wear for a while, a case made of stardust. It is matter that was created 13,780,000,000 years ago in the Big Bang, and that for a time lends us this stardust, which is energy, it is matter, and it serves a function that covers our true identity, our superconsciousness, and when we finish our role in this three-dimensional state, we give it back to the universe. Not an atom is lost.' So I wonder, is life interesting? They say life is amazing. They say in human life, so we are not really happy. We have moments of pleasure, but true happiness, which is this feeling of peace, of harmony that originates from within us, this is only felt when one understands and lives their superconsciousness. It's the same with freedom, true free will. True freedom is when one is guided by their superconsciousness, not by their ego. The ego is conditioned in this dynamic by a character with habits that have shaped that character, and this character influences how we think and consequently our emotions and mood. These habits have been taught to us, and many times it is not our true way of thinking. Therefore, true freedom is only through superconsciousness. They become quite intuitive. Intuition is knowing the truth without needing to reason. It happens automatically. It is a manifestation of our superconsciousness, which is omniscient, knows everything, and never deceives us. Another feature is that they lose interest in material matters. They see material things as a way to enhance their life in the human realm. But it's not a goal anymore. It's not the purpose it once was when they were driven by the ego, the egomania.